Hi viewers, welcome back to VETERINARY. In today's video, we will be dealing with the second part of pulp. With the cells of pulp, then circulation and innervation of pulp. So without further delay, let's get started. The first topic that we are dealing in today's video are the cells of pulp. So we will start. Start with the dentin forming cells, that is the odontoblasts. Now, odontoblasts are highly differentiated cells derived from neural crest cells. Coming to their dimensions, they are 40 microns in length and 5 to 7 microns wide. During active phase, these cells show increase in the number of cytoplasmic organelles, that is endoplasmic reticulum, Golgi apparatus, secretory vesicles and all. After the formation of primary dentin, the dentin forming activity or ability of odontoblasts slow down with decrease in the number of organelles. Odontoblastic processes are direct extensions of cells into the dentinal tubules. The fine lines that we are observing in the histological sections of the dentin are actually the odontoblastic processes that traverse into the dentin. The functions of odontoblast. The primary function of odontoblast is the synthesis and degradation of the organic matrix of dentin, intracellular accumulation of the matrix and all. The next cell that we are discussing are fibroblasts. Now, first of all, I want to say that fibroblasts are the cells that are present in maximum number. They have the capacity to synthesize and maintain the connective tissue matrix. The fibroblasts synthesize type 1 and type 2 collagen. These cells have branched cytoplasmic extensions with nucleus pushed at one end. They are more common in young pulp. The next group of cells that we are going to discuss are the undifferentiated mesenchymal cells. The undifferentiated mesenchymal cells are distributed throughout the pulp and more frequent around the perivascular area. They are stellate-shaped and the nucleus-cytoplasmic ratio is quite high. Under adequate stimulus, they can differentiate into odontoblasts or fibroblasts, but this event is not necessary. If there are undifferentiated mesenchymal cells, it is not necessary always for them to develop into odontoblasts or fibroblasts. Then we come to immunocompetent cells. They play a major role in local inflammation and immunity. These cells are actually derived from bloodstream. They are our lymphocytes, macrophages, dendritic cells and mast cells. Among them, knowing about mast cells is a bit more important. So these mast cells occur in small groups in relation to blood vessels. And in pulp, they are only present during pulpal inflammation. We will now discuss the circulation in pulp. So by this time, as you know, the pulp organ is extensively vascularized with vessels arising from the superior and inferior alveolar arteries and veins. The pulp doesn't have arteries and veins. Rather, it has a microcirculatory system which lacks true arteries and veins. The largest vessels that can be found in the pulp are actually arterioles and venules. Pulpal blood flow is very rapid and the pulpal pressure is the highest of all the body tissues. The speed that is observed in the bloodstream in pulp is 0.3 to 1 millimeter per second in venules, 0.15 millimeters per second in arterioles, and in capillaries it's around 0.08 millimeters per second. Let us now come to the innervation in pulp. The primary role of nerve fibers in pulp is to help the pulp in gaining conscious recognition of irritants. Mainly, there is the presence of sensory and motor fibers to fulfill vasomotor and defense functions. For pulp, the nerve fibers enter the apical foramen, arborize, and the larger nerve fibers are seen in the central pulp or the central zone of pulp, and then they proceed peripherally and coronally. For more details on the specific type of nerve fibers present in the pulp, look up in the picture that is flashing up on your screen. The next topic of today's discussion and the last topic for this video are the functions of pulp. Pulp has 5 primary functions, FINDP or FINDP. That's how we are going to remember it. F stands for formative, I stands for inductive, N for nutritive, D for defensive, and P for protective. Let us now discuss in brief what actually is meant by the formative function of the pulp. The pulp organ cells produce and surrounds the dentin that protects the pulp. Also, odontoblasts develop the organic matrix and functions in its calcification. The second function or the inductive function. In this, we will know that the primary role of the pulp and lodge is to interact with the oral epithelial cells, which leads to differentiation of the dental lamina and enamel organ formation. The third function is the nutritive function of the pulp. As we know, the pulp nourishes the dentin through the odontoblastic cells and their processes and by means of blood vascular system of the pulp. Coming to the defensive or reparative function of the pulp has remarkable reparative abilities. It responds to irritation, whether mechanical, thermal, chemical, bacterial, by producing reparative dentin and mineralizing any affected dentinal tubules. Protective function of the pulp includes the function of the sensory nerves in the tooth that respond to stimuli with pain. These nerve fibers initiate reflexes that control the circulation in pulp. So that was in brief about the dental anatomy and physiology concerned with pulp. In this regard, the last thing I want to say is there are 2 or 3 very important histological diagrams that we should know from this topic. The first one is are the zones of the pulp. That very diagram is very, very important. And the next one will be the aging changes or calcifications in pulp or the pulp stones. I hope this video was of help to you. Do let me know in the comment section about which the next video I should make. So that's all for today's video. If you are watching us on Facebook, do like our page. If you are watching us on YouTube, don't forget to like, share and subscribe to Vidyanagari. Also, do let us know in the comment section about which topics you want the next videos to be. Thank you. Have a nice day.